Hello, everybody. Thank you for joining us. I am Kristen, obviously with Aspen Dental. I am an academic and industry relations manager. So pretty much what that is prior to COVID, I would go to all the different residency programs, particularly the specialty. So the endo and oral surgery, and we would travel and get to meet you guys and, kind of talk about Aspen and some positions we have available. Due to COVID, obviously we can't travel anymore. So I joke about it and I say we live in like a Zoom virtual world anymore. So this is kind of how this, platform came about as well. So the nice thing about it is we still get to kind of, network with you guys and you guys get to learn a little bit about Aspen and so forth. We just get to do it from our homes. So with that being said, we have a Q&A box at the bottom of the screen. You guys can chat in whatever questions you have. Nothing's off the table. So anything that comes up, please put your questions in and I'll answer them accordingly. And I also have some questions that were submitted when you guys registered. So I'll make sure we address those too. So if you happen to see me looking over to my screen on the left, we just want to address those as well. So without further ado, I'm going to introduce Melissa Vendusky, who's a colleague of mine, and then we will introduce Dr. Tucker and we'll take it from there. All right. Go.
Hi, everyone. I'm Melissa Vendusky. Kristen and I work together with the specialist, as she mentioned, so endo, oral surgery, and yeah, we're just excited to have you. Thank you all for joining us, and we're very excited to have Dr. Tucker because she's one of our very successful endodontists and has been with us for a long time. So, Dr. Tucker.
Thanks, guys. Hi, I'm Dr. Tucker. I'm Jyotika. I've been working with Aspen for 15 years, 15 years, very successfully. So ever since I graduated from NYU in 2006. So, and I'm happy to be here and answer any questions you may have.
Wonderful. Thank you. Yeah. So I guess we'll get started too. If you just want to give us a little bit of background about, the location where you're at now, a little bit about that and how long you've been, a part of the Aspen team and so forth.
So I've
What
been
dental school and what residency?
Okay.
Yeah.
So I went to
yeah.
NYU for dental school and also for residency. And I did a GPR at Allegheny General Hospital in Pittsburgh. And I graduated from my endo residency in 2006. And I started working for Aspen at that time. And in the Connecticut area is where I work. So now I work in Connecticut and Massachusetts. I cover 14 different offices for them. So I work full time. And full time for me means on average like a 4-day work week. So that's where I am.
And then in those offices, how are you working that? Like how many days are you going to each location and managing?
So that depends on the office flow. So depending on what the volume is and how often they need me. Most of the offices I visit once a month, and then there's some offices that I visit twice. And then that's also a dynamic thing. So, things change. So the patient flow changes. So over the years, like an office that I visited, say twice, now I would visit once, or an office that I visited once, I visit twice. So,
yeah. Right. As I get busier too. Okay, good. So another question too, we'll get into a little bit about like the equipment and so forth. Does Aspen provide you with a microscope?
Yes. So what happens is that there's a stand in each and every office, and I carry the optics with me. So
Okay.
we have a global. I have the newer model. I can't really think of the exact what model it is, but and you can pick the kind that you want. Whether you want a 3-step, you want a 6-step. So you have like full freedom to choose what you like, and yeah. So there's a stand. So I carry the optics. Now that I have an assistant that I'm confident about, and I've had her for some time now. So then there are times when she would now she carries the optics and she has it all preset by the time I come into work. So
right, nice. And then going off the assistant too, how many assistants do you work with, and are they different at different locations and so forth?
So no. So I have one assistant who's completely dedicated to me. She carries all my equipment and she comes in ahead of time and sets it up. And so by the time I come into the office, pretty much everything is where I need it. Everything is set up. Either the patient's ready to be seated, or if they're early, they're seated. and then there's also, because I've been in my area for so long, you establish relationships with the dentists over there and the dental assistants even. And so every time I'm there, the office will kind of share an assistant with me. So somebody to say seat patients in the overflow chair, or to help with anything that I need with sterilization if necessary, or all kinds of things.
Right. Which is nice. It makes it for a nice seamless day, right?
Absolutely. Yes.
Yeah. Okay, good. And then what about, supplies and so forth? Like, can you pick whatever supplies you want? Do you have to transport them to each location and so forth?
So yes, you can pick any supplies that you want, whatever files you're comfortable with, and you want to use them once, you can use them once, whatever you're comfortable with. So you have full autonomy over what you order and what you want to use. And I do carry my supplies from office to office. Maybe if there's some solutions that you want to leave in an office, if you want to leave sodium hypochlorite in an office because you're concerned that it might spill in the car, you could do that, a few things like that. Um, in my case, the office supplies all the disposables, so you don't carry those. It's just
Right.
the endo supplies. So, yeah.
And you get to pick and choose what files you want and so forth, and burrs and right.
Yeah. Yes, absolutely. Yeah.
Okay, good.
A lot of residents will ask, with traveling to different offices with their supplies, how sterilization is handled. Are you sterilizing in the office at the end of the night? Are you doing it in the morning in the new office? How do you kind of move things around with
So
sterilization?
I think what we do is we sterilize in the office, except perhaps for the last kit. I call it a kit because it's in my last instrument cassette and everything that I use on my last patient. That we don't sterilize. That we sterilize next day morning. But otherwise, everything is sterilized same day.
But it
Right.
helps that you use the cassettes. Those are nice.
I'm sorry. Could you say that again?
It helps that you're using the cassettes.
Oh yes. Oh yeah. That makes it so
Makes it easier for transport.
Absolutely. Like everything is in one spot.
Yep.
Then it makes it easy even for the assistants in the office to help, like those that are not dedicated to me, because everything is right there. Just, throw it in the ultrasonic and put it in the autoclave.
Yep.
Simple.
Right, for sure. Now, what about a question came in about CBCT? And I know that's a big one that a lot of, I get all the time too. Do you have one of those in each locations, and how do you go about that?
So because I am in what would be considered a mature market. So one of the starting offices of Aspen Dental. So, I've seen so much change and growth in these offices in terms of technologies, like what we had, what we didn't have. I'm like pretty much a dinosaur for Aspen. So, when I started, no, really, when I started, like we didn't have digital x-rays even. And so we've like grown and changed. And so to answer your CBCT question, the newer offices all open with a CBCT. In our offices that are slightly older, there are some that have a CBCT, and that was a little bit, shall we say, it's slowed down since COVID, since the beginning of March. But now that things are going to look better soon, in another year or so, every office will have a CBCT. So
Right.
whatever,
Yes.
yes. So I by the end of next year, I'm quite confident. Yeah.
Right. Correct.
Yep,
Yeah. And I
that's
know
the
by the
plan.
next. Yeah, exactly. So awesome. All right. So getting into your procedures a little bit and kind of, explain a little bit about your day. I guess let's start with your day. Can you walk us through kind of what a typical day is like for you?
Well, sure, I'll certainly try. So, in terms of scheduling, I have say two columns that I'm not sure if I'm verbalizing that correctly. So in my main
Yep.
chair, I have procedures, and then I have an overflow chair where I schedule say post-ops, consultations, um, things of that nature. So so I have that. So the way I would schedule it is that I have the start of a procedure and the overflow appointment. They both start at the same time. When I go into an office, I have two chairs that they always give me, sometimes a third if I need it. Because nowadays we don't want to have anybody waiting. So if I need a third chair, then and say I'm running a few minutes behind, then they'll seat my next patient in. and just have them in the operatory, separate, isolated from other people. So, so I come in, I would numb up, speak to, introduce myself to my procedure chair, numb them up. While they're numbing up, I would see the patient in the overflow, a consult or post-op or something. Yeah.
Right.
And
Okay.
then that's how the day would flow. Then we take a break if you want to, or sometimes if I'm running behind, then my assistant will take a break and I'll work through it. And there's always like times during the day when you can eat. There's plenty of time actually during the day to do things that you need to. And so the assistant sterilizes in the interim, in the middle of the day, or I don't know. Does that
Yeah,
make
you
it
doing
I feel like that was very, very rambly kind of an answer.
no, it's
No.
great. How many would you say, how many patients are you seeing on, a typical day?
So I see maybe 6 or 7 patients a day, like sometimes fewer, because sometimes a patient might have multiple teeth that need treatment, and so that would make for a longer appointment. So but for the most part, I see a patient every hour.
Okay.
Are
Would
you
you say
doing,
are the main, oh, go ahead.
are you doing surgeries?
I'm not, but you can if you're comfortable, because I don't have that many patients. It takes me longer to do a surgery personally. Like I know that some of my colleagues who work for Aspen are doing surgeries a lot, like all the time. For me personally, it takes me a little bit longer. So the need of the office is perhaps that I see more root canals, although although the opportunity is there to see surgery as well. Yeah.
How many, like if you gave a general percentage of how many retreats you're doing?
Maybe 15% retreats. Yeah.
It's good.
And I do a fair number of retreats. Yeah.
And a question I get too is like about your day, do you feel like you have autonomy over your schedule? Like a lot of, residents ask me, are there quotas, and so forth. Would you feel that, you kind of get to pick out your schedule and so forth and express how much time you need, or do you feel rushed and have to hit quotas or anything like that? If you could explain a little bit about that.
Yeah, no, there's no such thing as a quota. I mean, I have pretty much raised my family here, so it's like work-life balance. If anything, that I really enjoy about my work, here at Aspen. So you can control the hours. Like for example, when my kids were in elementary, and I would say volunteer in their classes, I always did, and I would always schedule an office that was close by in order to do so. So I would I think I would block an hour and a half and like zip into the school and volunteer and then come back and finish out my day. So just like people would take a lunch, I would do that, and I did that for both my kids, like through elementary. And then if they got, if there was anything special, I don't know if any of you guys have kids, but sometimes they're like poetry teas when they're in first grade, second grade, or things like that. I didn't miss anything. um I would always, it was okay for me to take a half day if I needed to, or or start later and end later if I wanted to, or start later and end on time even.
Yeah.
Yeah.
It's nice to have that balance, especially
Yeah.
being a parent. What about going to like the patient base? There was a question in terms of, how are you working with, the general dentist and getting referrals, you having to find your own patients and so forth?
So no, actually, I have to say that I'm in a very sweet position in terms of I do not have to find my own patients because I'm in the office. So not only do I get the patients that are from Aspen Dental, in the office, that the general dentist in the office is referring to me, but I also now get a lot of outside referrals as well, because I've been in Connecticut for so long that and I've been working, they know that I come to these offices regularly, so I do get those referrals as well. So I'm never short on patients,
Right.
or I don't
Awesome.
have to actively do anything to get patients. I've never been door knocking to a dentist office to introduce myself or anything like that. Never had to do that.
I think that's
Yeah.
really important because Kristen and I both come from the same background. We worked for Patterson before this.
Yeah.
So we worked with a lot of, private practices. And the biggest thing that I used to get with all of the specialists was that the referral base has kind of declined over in the recent years because a lot of the general dentists want to keep their patients in house. They're starting to do more of these procedures themselves. And, technology is allowing them to do so because things can be done a little bit easier now with the technology that we have. So, the Aspen model, that was one of the things that kind of drew me over to the specialty side. I thought that was so great because, the general dentists, you're working for them in their practice. So they're
Yeah.
still getting a little piece of the puzzle, a little piece of the pie from your production, and they don't have to do it. They can see other patients
Yes.
while you're doing the endo work. So it worked. To me, that's like such a nice relationship.
It is, absolutely. It's a great relationship. Like, it's beneficial to them, it's beneficial to us. I think it's wonderful that I never had to actively try to generate referrals. To me, that's the best part, actually, because I can just get to focus on the dentistry and then go back home to my family and not have to worry about taking anybody out to lunch or
Mhm.
dinner.
Bringing donuts into the office, that
Bringing
kind
Yeah.
of stuff.
Yes. There's a
Chris,
lot
all
of
the
true,
stuff
though.
all the stuff you and I used to have to do all the time.
I was
right,
just going to
Chris?
say that's a big part of the day. And the funny thing, like I've been in dental for 15 years and going into practices, and that's the biggest thing I would hear is like, I got to find more patients. I got to find patients, that's like the biggest struggle is keeping a solid patient flow. So,
Exactly. And it's uncomfortable. It's not fun to do, really.
right.
And not
Right.
only is it not fun to do, what I find and what I hear from my colleagues is that their referrals are no longer loyal to them. That's becoming a bit of a problem.
Yep.
It's not that you can expect all the cases from one person like in the past. Like they would just, that can change very quickly, and that can affect your
Yeah.
flow and your office finances very
Right.
quickly. So we
Right.
don't have that problem here. I mean,
Nice. Good. We're glad to
And I
hear
think
that.
it's nicer for the patient too, right? Because they're comfortable in that office. That's their general dentist. So you're not sending them somewhere else. They're getting to see you as the specialist to do, good endodontic, superior endodontic work. And, but they still get to be in the comfort of their own dentist office.
yes, and it helps because there's not a lot of back and forth. Say if something unexpected were to happen, like there was a tooth that was, say, treatment plan for a bridge or something, and I started to do the root canal, and then I noticed that there's a crack in the tooth. I don't have to. It's easy because the dentist is right there, and I can communicate that, and then they can, if necessary, we can discuss it and see how that would impact the treatment plan and what we were going to do from that point on. So it's just makes communication a lot easier. Just the flow is so much better. Yeah.
That's a great point. I feel like it just makes it's more efficient for the patient that way too, though,
It
because
is.
then
It
there's not
takes
the back and forth, they're right there so you guys can communicate, right? Wouldn't you say?
Yeah, like you know how it is, guys. Like once you have a family, like getting time off to do anything is impossible. And the
Right.
last thing you want to do is have your patient have this back and forth,
Yeah.
Yep.
Okay, well, then they have to make an appointment to see their dentist, and then they're gonna have to come back and see you. Here, we're all here, and we'll just pop in as necessary. So,
Right.
Yep.
Yeah.
Awesome. All right. So what about for your, being that you go to different locations, like your post follow-up and stuff after a procedure, how do you go about that, being that you're not at each location every day?
So I feel that I'm very lucky where my offices are somewhat close to one another. They're easily accessible. So there's always an office that's about like 15-20 minutes away, and the patient is fine, making that short drive. It's not like I'm always an hour away, and it's not like that. So very often I do cases in 2 visits, or if I'm concerned about somebody, I'll have them pop in and see me for a reevaluation, or so. Yeah.
Okay. So there's no real issue with it. It's pretty.
Oh no, I haven't found it to be an issue where I'm inaccessible or not there for any of my patients. Never happened.
Okay.
And every market is different. So like you said, you're lucky because your offices are closer together.
Yeah.
There are some markets where that's not the case. And that's where I think, again, that great relationship with the general dentist comes in, because if you can trust your general dentist to take a look at the patient and kind of give you a synopsis on what's going on, even if you're not there,
Yes.
so that you can make the judgment if the patient needs to go somewhere else, if they need emergency treatment, whatever it is, like that's, again, another plus about having that relationship.
Right, Melissa, but that's also like a scheduling thing. So for example, like not all of my offices are very close. So I live in Connecticut, and I also cover some offices in Massachusetts that are about 80 miles from where I am or 60 miles from where I am. And some of the offices that are further to me are actually close to each other. And I will always be in the vicinity at least once or twice a week. That's how I plan it, so that I'm always close by, so that, yes, the dentist, I have an excellent relationship with the general dentist, and the patient can pop in and take a look at them. But then in a day or so, or a day or two, I'm somewhere close. Even if it's not close to me, I'll be close to where the patient is. Like I just distribute my offices, I schedule it like that.
Right, perfect. And going off scheduling too, there was a question too, how far in advance are you, booking out your schedule and so forth?
Nowadays it's at least a month out, maybe 6 weeks, and it's really busy. Yeah.
Yeah,
So,
I'm sure.
yeah.
Right. What about COVID? I know COVID's obviously, we're kind of getting our second wave and so forth, right? So constantly getting questions about that. Would you say, how is the practice? What have you seen how the practice has changed with COVID and so forth, and what Aspen's kind of done to help, make you and the patients feel safe?
So, we're lucky that we have a whole team that figured it out for us where we didn't have to struggle. So, definitely we have all the PPE that we need. Like the offices are, we've changed, maybe altered or adapted so that we schedule a bit differently now. The waiting area has changed, of course, just like anywhere else where there's nothing that the patient can really handle. And there's nobody in the reception room. Pretty much everybody waits in their car, for the most part. We check everybody's temperature. We have, of course, a symptom screening form. Um, and yeah, a lot of those things. Yeah.
Were you able to get the N95s? Because that was a huge, I know.
Yeah, of course.
Yeah.
Like, so the PPE, that's what I mean by the N95s, the face shields, the gloves, the gowns, boot covers or shoe covers,
Yeah.
or whatever you want to call them.
Right.
Yeah, they were delivered directly to my house. So, way back in March, maybe we took like a week off or 10 days off to just regroup and get all the PPE or the masks and everything. And they were in such short supply at the time, but we still had them always, and we're never short. Like to the point
Good.
where at one point I had like so many being shipped to my house that I brought it to the office, and I had to call them and say, okay, I'm good.
That's
Thank you.
awesome.
Yeah,
Because
yes,
practice,
That
like,
is,
yes, it is
that is
awesome.
a blessing, because
Yes.
so many practices can't get, certain things right now. So
Yeah.
they still
that's
can't get
really
certain
nice.
things
I
right
mean,
now. Yeah. It's still a struggle, which is kind of hard to believe, right? But it still is. So a question came into about about insurance and so forth. If you can kind of go over, if Aspen pays for malpractice.
I think that it's hard. They do. I think maybe you have to pay a certain portion of it. I think the specific questions like that we could probably, if you're interested, we could talk about that like in greater detail. But they pay for long-term disability. We have excellent benefits. You have like a 401k plan with a match, which is great. Then I think that the malpractice is perhaps a shared expense, or so yes, they do.
What about in terms of
yeah,
the
my
patient?
internet is
Oh,
kind
go
of
ahead.
going in and out. Do you hear me?
Yeah.
Okay. So yeah, the malpractice is covered up to a certain amount. And then if that particular, your particular individual whose malpractice insurance is a little bit over that, maybe if you've been practicing for a while and you have a few dings on your license or something like that, then you would have to cover the difference. And it's also prorated if you're part-time. So we give a certain amount for full-time, and then we kind of prorate that depending on how many days per month you're working. But for most residents coming out of residency, if you're full-time, what Aspen pays in will cover your entire practice for the year.
And then what about insurance for the patients? What insurance plans does Aspen, take?
So they take a whole bunch of different plans. As a specialist, I think that you could look at the plans and see what you like and what you're willing to accept and what you're not willing to accept. I find that I accept most plans. So
Okay, so good. So that's not an issue. So maybe you can talk a little bit about, obviously you've been here for a while, which is amazing. But if you can talk a little bit about to some of our, newer residents, looking forward a little bit about how you manage your job search, during residency and so forth. You can kind of discuss that a little bit.
how do I manage my job search? So I spoke to my professors a lot at school. I got a lot of advice from them. Of course, there's JOE with their job listings, and then you have the meetings like the AAE and the APICs. They have some job listings as well. That's how. Yeah.
I get a question a lot too, like when do you feel like is going into, I guess, your last year of residency, right? Like how far out were you looking to kind of find a job and secure, the perfect job for you? What would you say, how far out would that have been roughly?
Are we talking about like geography wise or
No, like time
like
frame, like a lot of them ask, yeah, when should I start looking? How,
when should you start looking?
right.
I started looking fairly, I was moonlighting and I
Okay.
started looking fairly early. In your second year, beginning of your
Mhm.
second year, basically, because I went to a 2-year program, NYU was a 2-year program at the
Mhm.
time. And at the beginning of the second year is when you really start you start setting feelers out, take a look around, you like kind of self-reflect a little bit. Hey, what kind of practice do I want to work in? And as you get closer, say to December is when it really gets serious and you take a couple interviews and things of that nature is how it usually works out. Yeah.
Right.
And then you do a few working interviews if you have a license already, or you go in, you meet practice owners or take a look at the office where you're considering
Right. Of
working.
course. What would you say was the process when you came on board with Aspen, the interview process and so forth?
Oh, I'm
I
not
know
sure
it's
that
been a while.
yeah, that I can I'm not sure if it's the same anymore, but when I came on board, I met with the regional manager and with the director of the area and with the COO. He was happened to be traveling in the area, and so I met him as well. Although that's not the case usually. And then
You got lucky with that one.
yeah, and we just had a conversation. It was very easy. We just it wasn't we just talked, and they told me about their practice and their practice model, and I told them about myself, and it just seemed right to me, and yeah, it was easy.
Yeah, good. Nice.
Yeah, I'm
That's
not
what I
sure
like to hear.
if there's a specific question related to the process, and I can answer it, but my experience was just that was it basically. Like
Right.
I was excited. I liked the model. I liked the work-life balance. I had my son when I was in my residency, so I was excited about the fact that there would be no on-call, that there wouldn't be any Saturdays, that I could my schedule was flexible, so all of those things were very important to me.
Right. Of
And
course.
so I thought it was perfect.
And then, if I guess at this point, would you recommend Aspen to somebody coming right out of a residency? And if so, why?
I would. I think actually I think that it's a great place to work if you're coming out of residency or even if you're already experienced. Now we have such an amazing network of people and we have so much infrastructure that we didn't have when I graduated. So you
Mhm.
have so many people. You're not alone, you know. So there is when I started, there weren't that many of us. I think maybe three of us,
Oh, wow.
maybe,
Really?
you know,
Yeah.
and so I wasn't sure how to pack the equipment. I wasn't
Yeah.
sure what to use. And so I took the help of one of the dentists, one of the general dentists, and he was like, and I was trying to pack my stuff. And it was before I actually before I started, like a couple of days ahead of time. I was just trying to figure everything out, and he was like, and he helped me, because there
Right.
wasn't anybody else, and together we figured it out. At the time, I had a very seasoned dental assistant who kind of took charge of the equipment and the packing, was very organized, and it's not so much, as it's not the work, it's not the root canals or the endodontics
Mhm.
that's difficult. It's perhaps the logistics that seem overwhelming at first to somebody who doesn't have experience. But
Mhm.
now it's so easy. You could either come and shadow someone, and somebody will fly you out and put you up in a hotel, and you can see
Mhm.
work with one of us or watch us work, or you can see
Right.
how we pack our things, and you don't even have to fly out anymore. We can Zoom.
Yeah. Yeah,
Yeah, right.
exactly.
Yeah,
Right.
like
Never have to leave
that's
our
how
house
old school I
anymore.
am. I like fly out, and what's all that, right? You can just Zoom, Zoom
Right. I know.
cell phone out and take a video and show. You could talk about how do you take the equipment and what does the day look like and where do you keep your. You might have a question like, okay, like I want to use ultrasonics. Where do I mount it? And I could show you
Mhm.
where I mount mine, or some other endodontist could show you where they mount theirs, and you have that to that help that you're not alone. All of us are here, so it helps with getting settled.
Right. And
Yes.
I think like Melissa, what do we have now? 50 or 60, right? Like in total at
Yeah, and
least?
we have so many new offices being built, and we're doing such a big endo push for next year, because we did that last year with oral surgeons, and so a lot of the oral surgery positions were filled, and now we have all these endo positions open, and so we're gonna probably double the endo team next year, hopefully.
Amazing.
Yeah.
Yeah.
Yep.
Great.
Which I
Dr.
think is
Tucker,
nice for,
you
yeah, go
just gave
ahead.
me an idea, and you're going to want to stick your foot in your mouth now, because as you're saying this, I'm thinking that's a good idea. We should do like a not with the patients in the chair, obviously, but just for like setting up, breaking down. I'm going to put a GoPro on you, the camera, and we're going to make like do like
Right?
a
A
little
tutorial.
1 hour setup tutorial. Exactly.
Yeah. Right. So funny. But it's funny how it comes full circle. Now we have 50 plus or so, and it's nice because there's like you said, there's a whole team of you now and like a mentorship, right? You guys kind of have each other to piggyback off of, so you don't feel like maybe you're the only one at that location, but there's a whole team behind you, right? That you guys kind of can piggyback off of, even though you may not be in that like same location.
Yes.
So I guess, the next thing I would love, to ask, that I like to ask everybody too, is what would you say are like, what would you say is the best thing about working here at Aspen that you love the most, that you can share with our
It's hard to say if there's any one particular thing that I love the most. For me, I think it's been a perfect fit. I like everything about it. I like going to the different offices because I feel I'm not stuck in the same location.
Mhm.
I personally like that. I enjoy the fact that every day is a little bit different but still the same because I have my equipment, I have my dedicated assistants, and the offices pretty much look the same. So that's great. I enjoy the work-life balance. I would be remiss not to mention the excellent income potential that it's like having your own office without the hassles, really.
Mm.
So what's not to like in that?
That's huge.
Yeah, and I enjoyed having a family and being there for them. Especially enjoyed that. There's a lot really. There's not one particular thing that stands out. It's the whole package for me that was great. I love
Mhm.
the little reminders that I get. Oh, Dr. Tucker, your DEA is up for renewal. I like
Yeah.
I need
Hey, it
that.
helps. I need lots of reminders.
I enjoy that, you know.
Yeah.
um,
Yeah.
yeah. So it's not just
That's
one
great.
thing, really. It's
Right.
everything.
No, I'm happy to hear that. That's awesome.
I have a question, just because you have been around for so long, and like you said, you were kind of one of the, original endos. When you were coming out of residency, especially at that time, like DSOs really weren't the norm.
Yeah.
How did like your colleagues and your program director, like what were their thoughts on you coming to Aspen? Just curious.
So
'Cause things have changed, it's
yeah,
different
yeah, no,
now.
things have changed. So my colleagues weren't that they weren't sure that that was the right thing to do, but my mentor, like my program director, NYU, they're just so I thought that they're always very progressive and open to new things.
Mm.
And this was at the time a new thing, and my director said that he said, oh, this is great. I think that you would be a good fit. You work very well independently, and plus this is, see, go give it a try. You might really like it, and there's lots of opportunity here, and so you should go. And he was very encouraging, so I gave it a try. And this is where he said, give it a try. If you don't like it, you can always quit.
Mhm.
And here I am. So still doing it
15 years later.
10 years later.
That's awesome. That's awesome.
So I guess it was a good decision. That was good advice he gave you.
I
Yeah,
agree. Yes.
we'll take that. I know you said, we'll close it out too, but do you have any, last minute final things that you can share with anybody that we have, any last words of wisdom with our participants tonight?
Well, I would just say, if you're curious, then, give us a call, like, reach out, like, speak to us. Um, just, come take a look. You might find that this is exactly where you want it to be. And if it isn't, that's all right too. But, if you're curious, I feel that you should explore it. It's a very, very good opportunity that you should explore.
Awesome.
We agree.
Yes, very much so. Well, thank you, Dr. Tucker. I can't thank you enough for coming on and joining us tonight, and all of our participants as well. Thank you so much for taking time out of your evening. We hope you got a lot out of this, and we wish you all a very happy Thanksgiving.
Yep.
And yeah, please reach out to us if you have any further questions.
Well, thank you so much for having me here. Yeah. Happy
Yes, thank you.
Thanksgiving.
I'll be sending the GoPro to your house. Look out for it.
Sure.
Thank you, Dr. Tucker, and thanks everyone.
Thank you.
All right, happy Thanksgiving all.
Take care.
Bye.